There are just so many things going on in healthcare this week, I couldn't pick one. So let's hit a few. This is Healthcare Triage News. First up is politics. A few weeks ago, we covered the ongoing debate about the cost of Medicare for all and how this had become now an argument about cost, not necessarily about whether it could happen. This week, Republicans rolled out a new tactic to fight it. Governor Rick Scott of Florida, who's currently running for Senate, tweeted this: "If you want to protect Medicare, vote Republican. If you want a socialist experiment with Medicare, by all means vote Democrat." This has all the feels of that old sign from some campaign that said, "Keep your government hands off my Medicare." Y'all know that the government totally runs Medicare, right? It's socially financed healthcare. It's the closest thing we've got to a single payer in this country, right? It is like the closest thing we've got to socialism. And if anyone's been trying to change Medicare in the last decade or so, it hasn't been the Democrats. Remember vouchers and potential privatization, and we've covered that in previous episodes? Those weren't parts of the Democratic platform. The gist of this is that Republicans are trying to warn people, especially the elderly, that they fear that healthcare reform is going to come at the expense of Medicare. There hasn't been much evidence of that, but it sure makes for scary ad copy. Some news on the opioid epidemic. In 2017, more than 72,000 people died of drug overdoses according to the CDC, which is the worst year on record, and almost all of those deaths are from opioids. This week, Richard Sackler, who's part of the Sackler family, which owns the drug company Purdue, which made, until recently, the drug OxyContin, which has been blamed for its part in causing the opioid problems we're seeing now. Anyway, this week we found out that Richard Sackler was granted a patent for a drug reformulation that might help people addicted to opioids get weaned off. So the guy whose company's been accused of helping cause the opioid epidemic can now make tons of money off of trying to curb it. Nice. Let's finish off with some ACA news. The AP and Avalere Health crunched the numbers on state-level data for Obamacare premiums and found out they're stabilizing. They found that across 47 states and Washington, D.C., there was an average 3.6% increase in proposed or approved premiums. They're expected to drop or increase by less than 10% in about 41 of those states. 19 states are also seeing new insurers enter, or insurers that are already there expand into new markets. No counties in the United States lack at least a single insurer. All of this is good news and points to a stabilizing market. But it's not perfect. Insurance is still really expensive, at an average of $600 per month for an individual before subsidies. Sure, almost everyone gets subsidies, but that's still a lot of money, and there's still trouble on the horizon from the Trump administration. They're still saying they won't defend the pre-existing condition protections in a Texas case. There's still the matter of short-term insurance plans, which we've covered before, and how they might come into play. There's still talk of repeal. So for now we watch. November midterms will tell us more. Do you like the show? Always helps if you like or subscribe right down there. And another good way for you to support the show is a subscription service called patreon.com, where you, the viewer, can directly support on anything you like $1 a month. More if you like, but if you don't want to, totally fine as well. Go to patreon.com/healthcaretriage to see how you can help. We'd especially like to thank our research associates, Joe Sevitz, Crafty Geek, and Jonathan Dunn, and of course, our Surgeon Admiral Sam. As always, go to hctmerch.com to pick up good Healthcare Triage merch, and my book, The Bad Food Bible, still on sale in stores.